An additional 68 people have tested positive for COVID-19, bringing the total number of known cases in Laos to 672. The National Taskforce for COVID-19 Prevention and Control announced the latest development on Thursday, April the 29th. According to an evaluation of the situation by the World Health Organization or WHO, it is possible that the number of new cases of COVID-19 in Vientiane next month could increase to 2,000 if people do not curb travel and do not stay at home. These restrictions are essential under a Prime Minister's order aimed at keeping the virus in check.
เก็บตัวอย่างมากวดวิเคราะห์ทั้งหมดสำหรับสปป.ลาวเฮาแม่น 2,817 ตัวอย่างซึ่งว่าในนั้นพบผู้ติดเชื้อใหม่แม่น68คนเนาะ
An additional 68 people have tested positive for COVID-19, bringing the total number of known cases in Laos to 672. 34 of the total new cases were identified in Vientiane, 11 in Champasak, 10 in Pokeo, 8 in Luang Prabang, 2 in Luang Nam Tha, 1 in Vientiane Province, 1 in Udom Sai, and 1 in Phung Sali. The skyrocketing number of new cases in Vientiane is being attributed to people disobeying travel restrictions and the advice to stay at home, making it difficult for authorities to contain the spread of the virus. The positive test results were obtained when 2,817 samples were tested on April 28, according to the National Taskforce for COVID-19 Prevention and Control. Meanwhile, 622 people infected with the virus are in isolation at the Friendship Hospital and other public hospitals in Laos. No deaths have been reported. The majority of people who have contracted the virus are between the ages of 20 and 39, as well 3 children under the age of 3, 2 people under the age of 6, and 8 foreign nationals. The National Taskforce for COVID-19 Prevention and Control outlined the latest development on Thursday, saying 50 COVID-19 patients were discharged from hospitals on Monday after they twice tested negative for the virus. Of the total 672 cases, 439 have been reported in Vientiane, 8 in Vientiane Province, 92 in Champasak, 22 in Savanakhet, 24 in Bokeo, 6 in Salawan, 3 in Udom Sai, 6 in Luang Nam Tha, 14 in Luang Prabang, 3 in Phung Sali, 2 in Bulikam Sai, 1 in Sayaburi, 1 in Sieng Khwang, and 1 in Kham Muon. COVID-19 task force members say there are still a number of people disobeying the lockdown rules and driving around Vientiane. Health officials urge everyone who thinks they have come into contact with an infected person to self-isolate for 14 days. People who need to leave their homes are advised to wear a face mask, regularly wash their hands with soap, and avoid touching their mouths and eyes, as well as maintain social distancing. Every province in Laos is now under lockdown as the COVID-19 outbreak spreads.